Hi, everyone. We're just going to give it a moment for people to join, and then we will get started. Hello, and thank you all for joining us today for the first part of the three-part end-to-end RAIN RFID solution-focused webinar series, Proven Results in Healthcare, End-to-End Solutions, where the panelists will talk about how RAIN RFID with essential medication data encoded on tags transforms pharmaceutical supply chain security, as proven by the Axia Institute's pilot study, ensuring authentic medicines reach patients safely, reducing counterfeits and errors. Just a few logistics before we begin. We anticipate the presentation will last approximately 45 minutes, allowing us 15 minutes for questions. Please kindly submit using the chat box on the control panel on your screen. Questions will be answered at the end of the presentation. Additionally, the call is being recorded and it will be made available to the public following the close of the presentation. On behalf of the RAIN Alliance, I am pleased to introduce to you our moderator, Dirk Bratt from CCL eAgile, who will introduce the panelists. I'll turn it over to you now.
Thank you, Elizabeth, and thank you to the RAIN Alliance for hosting, and thank you to everyone who have joined today's webinar. Today we're going to be discussing something that many of us probably don't spend a whole lot of time thinking about, and that is where the medications we take have been and how they got from where they were made to where they are administered to us as a patient. In fact, if you're like me, I don't like to even look when they give me a shot, and I certainly don't ask my caregiver if what they're giving me is the genuine article and not expired. I just trust that there's systems and regulations in place set up to get medications to the right place at the right time and to protect patients from things like counterfeits or expired medications. Now, the reality is that there is a complex and highly regulated supply chain behind our medications and vaccines, many of which have been on a long journey with many touch points, starting with the manufacturer, then off to wholesalers, where large orders get broken down into individual orders, and off to one or more pharmacies before they're even put into the hands of our doctors, nurses, or our patients. Today, we're going to be discussing this topic and how a recent groundbreaking study and resulting white paper shows how RAIN RFID goes beyond the Drug Supply Chain Security Act, or DSCSA, and the current barcode requirements to store all the critical information onto the medication for a faster, more accurate, and ultimately a safer supply chain. Let's start by introducing today's three panelists. First, we have Bahar Aliakbarian, PhD. She is the interim director and lead researcher at the Axia Institute at Michigan State University. Welcome, Bahar.
Thank you.
Next is George Dyche, vice president of Endpoint IC product management at Impinj. Welcome, George.
Thank you, Dirk.
And our third panelist today is Aaron Sundman, RFID business development leader at CCL eAgile. Welcome, Aaron.
Thank you, Dirk. And I know you're one office over for me right now, so I'm listening on both sides.
We're close. So let's start with the Axia pilot and the release of the white paper, which has been creating a little bit of a buzz in the healthcare and RFID worlds. And please, as Elizabeth said, audiences, feel free to enter your questions in the Q&A area, and we will save some time at the end to address as many of these as we are able. Now, from what I understand, the Axia pilot tested RAIN RFID in a real-world pharma supply chain with the help of many partners and industry leaders. And Aaron, I know you were involved in the study from early on. Can you set the stage by giving us a kind of a quick overview of what happened during this pilot, which I believe is the second phase of a larger study? So maybe you can tell us a little bit of the difference between the two phases as well.
Thank you, Dirk. Yes, absolutely. This was a fantastic pilot. I mean, and I have to say, hats off, even though I don't have a hat on to Bahar, John, and Ethan for what they decided to move forward with, right? How do you prove something out that no one else has done? No one's even tried this yet with full on, absolutely everything tagged with lowest saleable unit up through the cases, and then even the SSCC tags, and then prove this all out. So that's what we did. And here's the highlight, hit the headline. We now can have a fully validated drug supply chain. That is now attainable. This study shows that it's possible now to check and see every single item that's put out from a manufacturer using RFID validated without even opening the box. This is amazing because now you can actually just take a box off of a pallet, put it on a conveyor, and have it run through, and every single item be checked. And if there's any problem, it'll turn it around. And then you'll solve the problem. You'll find the problem much earlier. So let me run through what the actual study looked like. So first of all, again, thanks again, Bahar, for making this effort to do a study like this, to prove to the world that it's possible. So let me jump in and quickly just do a quick share. I want you to see kind of the whole thing, just so it doesn't feel like a theoretical exercise, right? So that's the idea here. So first of all, what you see here is the end-to-end RFID pilot in its sort of overview form. All the products started at Fresenius Kabi. They decided they would give us 4 pallets of drugs shipped over to Axia. We would tag them up that way. Then we did 3 things basically at Cencora. We received them at the Williamston warehouse. We did some picking and packing to 6 different pharmacies, or basically, there we go, 6 different pharmacies. And then we shipped them out, validated everything. Oh, my zooming in is getting crazy on me. And then we're received back at Axia. So let me walk through just what that looked like every step of the way. So this is the pallets, all 4 pallets of 4 different drugs. Then we took and we encoded on every tag. So you can see Fresenius Kabi already had a serialized barcode on there. So we just used that data. We scanned it, so you can see Ethan there scanning each barcode, and then Danny putting a little tag on each one, and then Bahar puts it into the box. So that's what we did. They weren't already tagged with the lowest saleable unit, so we had to do this. It took 2 days of sitting there moving these things around, but it worked fantastically well because Fresenius Kabi already had it serialized, already had the GTIN, already had the lot, already had the expiry on the data barcode. So all we're trying to do is to take it and say, you know what? What if there were magical little barcodes inside that box that could be read without line of sight? That's what this does. It turns this whole thing into something that's possible to be read from a distance without opening any box. So the next part right here, then we created the EPCIS data file. So this is what the manufacturer sends to the wholesaler, right? The aggregations are all in there. Everything is in a standard format that GS1 has put together for us so nicely. It's ugly here because it's XML, and I'm not a big XML fan, but it works really well because it's standardized. Then, now I couldn't get any videos at Cencora, but you can see what happened is all we did was we took each box from there after we set up this conveyor. The cool part about this conveyor is we rolled in the conveyor. We didn't have 2 or 3 days or a week to configure and optimize. We basically rolled it up like I was a 12-year-old with a new 10-speed and set it there, and it worked very well. It was amazing because then we picked up each box, set it in there. It validated every single item in that box, serial number by serial number, and proved that what the manufacturer sent was what the wholesaler received without opening a box. That's amazing. And that's a big difference from what we do right now because we can't get to everything right now. You have to sample a bit of it. So this is an approach that starts to say, this is now possible to get everywhere. So then we mixed up everything into totes. So then we ran the totes through. So this is the part, you can see the green screen basically says that everything in there was correct. All the items were correct. And then we recorded all the serial numbers so that we could create the EPCIS data files to go back to the pharmacies. So this was all done automatically by this conveyor. So this is the team that was at, this is the best shot I have of Cencora. Look at those fantastic people. You look great. And then once we got back at Axia, then we ran those totes through. Now, the cool part about the totes, these were mixed totes, right? So not only was it validated that they're right items, but the exact right serial numbers. And if there was anything wrong again, it would turn it around and say, hey, would you rather find out now if there's a problem or wait till 2 weeks later or 2 months later when someone picks it and now you got to figure out what the problem is? A lot of these exemptions that are coming that have been out there are ending soon. So we have to make sure that we have a system in place. Now, again, this is not something that's in place right now. This is the first real study that studied that and proved it, but this is now available. So I wanted to kind of show that. And it's, here is the Axia Observer platform. So you notice this, the stuff I worked on was all the micro stuff, the individual, the checking of each item. The Axia platform had an overall view and said, let's track every single item all the way through from pallet to pallet, to tote, and to all the pharmacies. So that's what we do. The Axia platform they put together allows us to be able to have this overall view. And let me go down even further. So this is the macro view of everything. Now let's go down and look at the individual item. So also in the Observer platform is to be able to say one particular GTIN, one serial number, watch it go between everything. So this is sort of an overall view looking down on everything, as opposed to what we've done in the past, or at least what I've worked on is line by line, serial number by serial number. So this is fantastic for that. So the last slide I have here is basically to allow anyone at some point in time, you can do it now, or you can watch the recording later and get a direct link to the website, the white paper, or the podcast that we put together that kind of does a 20-minute overview in a more natural language. The Bahar actually created that one as well. So anyway, that's that. I wanted to show you that so that you're aware of what the study was, and that will lead into the rest of this.
Yeah, so what was the key result of that came out of that? Did you get, what was the percentage?
Well, 100%. So this is the crazy part, like 100%, every single item all the way through was validated. Now, there were some errors, like when I was picking and packing, I'm not good at that apparently, just to be clear. So when you're putting hydroxylate and tetrodotoxazone or whatever it is, and you mix it, if you make one mistake, the system will catch it. If you make 20 mistakes in one tote, the system will catch it. If there's one serial number incorrect, it'll catch it, turn it around, allow you to fix it instantly, send it to a hospital. So that was 100% validation of every single item all the way through.
So you cleverly introduced human error without even trying.
Yeah, I was really thinking there.
And how many transactions did that total?
Yeah, with the
graph is complex.
With the 7,000 items, the number of reads were 40-something thousand individual reads done all the way through. So some of them done at Axia, some of them done at, lots of them done at Syncora, back at Axia. So, and we in this case, we actually pretended like there were 6 pharmacies and broke up the orders to make sure that we had to be able to say every single box needs to go to the right place, right serial number all the way through.
Fantastic. That's a lot of touch points, So every distribution system wants accuracy and efficiency, and RFID has helped many industries achieve this. So why does the Axia pilot matter specifically to the healthcare industry? And let's start with Bahar. I'd be interested in your views on this.
Yeah, thank you so much, Derek, and thank you, Aaron, for setting up the stage. It was very helpful to see the overall process. So to answer to your question, I just want to make the audience reflect a little bit on your opening phrase, Dirk, that you mentioned that would it be possible when I am receiving a medication, when I want to enter an external product or material into my body or to my loved one's body, would it be possible to know where that product is coming from? Was the product authenticated? How was the process? How was the journey behind that product? Where did that product go? How was the environmental condition? Was the product being exposed to high temperatures or UV radiation? And so many other stuff, like where was that manufactured, when it was manufactured, and then when that product was shipped, how long it was stored in that first point of storage, and how it is now come into my body. So a few years back, answering to those questions was not possible. So that was just an imagination. Oh, I would love to know what is this product that I'm using now. But now with the advancement of the technology and the maturation of these AIDC technologies, including RFID, it is possible. And that was the major goal behind these pilots, that we wanted to showcase to everyone that all of these imaginations few years back, now it's possible just by adding a sensor like RFID into pharmaceutical products, and just with the very easy and simple scan. So you can get all the information that you are interested to know. Nothing was done before in a real world environment to demonstrate that actually it's possible. Again, one more reason behind this pilot was answering to a lot of myths that were related to RFID. Few years back, everyone was talking about RFID challenges in different environments, like solutions, liquids, different packaging form factors, or even a lot of RFID tags together. Somebody was telling that RFID is not working. So with this pilot, we actually shown that it is working. So the technology, the sensor, the chip, the integration of all of these um, solutions together has been matured and advanced enough that no matter what the product was inside those packages, those four full pallets of products with different drug formulations, liquids, different dielectric properties, different product package sizes and shapes, all of them, a lot of 7,000 products close to each other, as Aaron mentioned. We wanted to show that the RFID works now with the advancement of the technology. And we actually demonstrated that all of these products with different full factors moved from one location, from Midland, Michigan, to another location in a real warehouse, Williamston, Sencora warehouse, using a normal truck, and then doing all the processes that normally they do in a distribution center, opening the packages, again, mix and matching product, creating new labels and new orders, and again, ship everything back to the Axia. We showcased that those RFID tags work. Nothing was damaged, nothing was broken, nothing was not readable due to interferences. And then, most importantly, we were able to capture all the information that is important to make sure that this product is safe and authenticated and not expired and serialized and coming from the origin that we wanted to know. So all this information was able to be captured during all this movement of the products. So that was the reason why this pilot started, and that was the reason that it's important for not only healthcare, but also for all of the other industry looking for end-to-end traceability solutions, that we showcase that the technology works in real-world environment, no matter what the product is complex, no matter how the supply chain is complex, the system can be integrated, the technology can be implemented, and you can get the result that you wanted, in this case, making sure that the product that reaches the patient is safe, authenticated, it's not expired, and it reaches the right time at the right place that we also wanted. One more aspect of this pilot that we demonstrated was is related to another myth related to RFID, which the implementation is difficult. There is so much need to change the infrastructure, and it's not easy for operators to work with this technology. We actually demonstrated that a few of us that we have never worked in like a distribution center. We were always working in the offices or in the laboratory environment. We just followed some of the guidelines and best practices written, and we used all those processes in a real world distribution center, and we made everything happen in just one day instead of 2 days that was planned to be. And so just imagine if we were able to make it in one day. So if like the experts, if the people that are working 6-7 hours per day in the manufacturing site, how much easier they can follow the process. And obviously, as Aaron mentioned, we made some mistakes, intentionally or unintentionally for picking process. But the good portion of the good part of the pilot was that all of those errors were captured immediately, and we fixed them immediately before the pallets or the new orders were shipped out of that environment. So everything was captured in real time, corrected in real time, reducing all of the errors down to the supply chain.
Yeah, yeah. Well, everybody assumes, that errors will be made in a complex system like this and a lot of other complex supply chains as well. But yeah, that's having the oversight to correct it and the data that you can gather it and go back and look at it and see where it happened, why it happened, and do the corrections as needed. So very interesting. Aaron, do you have thoughts on this?
Well, yeah, I think it's funny because you said everyone thinks that. I actually said at the beginning of the day, I said, hey, why don't we introduce some errors in there? And they're like, Aaron, you're so naive. You think everything is just going to work perfectly? And the beautiful thing was, even corporate could do it. This is the quote from Sean Murphy from Syncora. He's like, the reality is we didn't do picking and packing. I've never done it before. I have no idea what I'm doing. We were grabbing 40 boxes of this and 20 boxes of that and trying to get, we had 80 something items in some of the totes that, were mixed. So we made a lot of those errors. The system caught 100%. So the only advent to that, or the addition I'd like to add is, yes, corporate can do it if there is a system that will guarantee checking and validating every single time, because that's the only way it worked for us. Yeah. So the interesting thing about that too, though, is this is the part where we go, the reality is the supply chain has been needing to be worked on for a long time. The what do they call it? The Prescription Drug Marketing Act in 1987 tried to address this. Like the DSCSA now is the one that's in place. But this is the first time, I think, now that 38 years later, we found the rules are in place, the laws are in place, the technology is in place. Now, you don't have to do lookups, right? If I had to look up 80 something items while in 2 or 3 seconds, while it's inside that conveyor, check every one of the serial numbers because I had to do another lookup somewhere. If I have all of that data on the tag, including validating the GTIN, the lot and expiry that was in the EPCIS data file, now all of a sudden I've got everything I need to do it, and I do it in real time with a query. I basically pull things into data arrays, so in memory, and I run through and validate each individual serial number. If there's one single number wrong in the entire thing, I can turn it around. Now, you can reduce that and say, okay, give me 99%, I don't care, give me 85%. But we went for 100%. And we validated 100% each individual item. So real-time correction is what did it with minimal training. That's all I have to say.
Yeah, yeah. And to not have to read a barcode every time is huge. I mean, I think of the self-checkout line, and I spend more time just trying to find the barcode just to scan that than I probably did trying to find it on the shelf. So
yeah, there it is.
I can't imagine doing thousands and thousands of those and then scaling that up every day across everybody without missing a scan or scanning the wrong item. And I'm good at that. I like to scan wrong barcodes, and if there's 2 or 3 of them on a package. So. But George, you have a unique position in this discussion. We typically say chips and readers kind of power the RFID ecosystem. So what is Impinj's takes on this study and the impact on healthcare?
Yeah, well, one, I think congratulations on the study and job well done. I think, challenging environment, large number of items, higher memory in the tagged items. So fantastic results. I think the study and pilots in general are really essential and important for solving industry problems and driving adoption of the solution that will deliver on the value proposition that an enterprise is looking for. So if it's around patient safety, if it's looking at internally at their own key stakeholders, their employees, right? How do you reduce cognitive loading so they can do their tasks easier, more efficient, faster, and redeploy their time into more value-added services? So enterprise has a lot of key stakeholders, so they should lean in and look at RAIN RFID as a tool that they can hire for bringing immense value. And to show value, you do that through pilots. And with other industries, be it apparel, supply chain, logistics, they all go through a journey of, I've got a business challenge, I have proof of technology, which I believe first phase of the study validated that. And then let me do a pilot, proof of ROI, proof of value. And then from there, you move into how do I scale within my enterprise within a building, my enterprise, and then my ecosystem players. So the pilot in of itself is very critical in demonstrating RAIN RFID. I've been in the industry for decades. At Impinj, we just celebrated our 25th year of innovation. So very excited to see RFID, RAIN RFID moving into the healthcare. We've seen it many, many places. But I think a fundamental undertone here, which is you have the tagged item, right, with the endpoint IC is carrying critical information about the product, right? So lot, expiry, its G10 serial number, and that's producing data that the enterprise can then take and say, what do I do with this? I can ingest it into software, ingest it into different platforms. And Aaron, what you showed around real-time error tracking, right? They saw there was a human error and it was corrected by the technology. So in that, the pilot demonstrated a lot of technical feasibility, 100% reading. It also demonstrated some of the human change management that may need to be required. So that could be, something to look at it going forward. It demonstrated that liquids and metals and high density environments of getting that critical data out of the tag, you can do so efficiently through the technology. And then I think fundamentally it's an inspiration for others to lean in and say, let me take a closer look at this. Let me get involved. And I think it's really important to lean in and step in with RAIN RFID and see what value it can truly bring to your enterprise.
Yeah. Like we talked a little bit earlier before we got on, it's like everybody loves new technology and the leading edge, bleeding edge. Just nobody wants to be first. I want it to be proven and before I jump into this. So I think this pilot and resulting white paper really went a long ways to show that this is possible and this can be done. So but let's move on to our next kind of topic point, and we'll talk about the data next. So the Axia pilot used the RAIN RFID tags and coded what everybody's described to me as essential data. Now, I can think of a few things that I would call essential, like information about the medication or expiration date, but I'm sure there's a lot more to this. So let's start with Aaron. And why is it important to have this essential data immediately available on the medication, put up directly onto the tag, right onto the medication?
Yeah, thanks, Dirk. Here's the thing. When we encoded this, we encoded them in the newest TDS 2.0 encoding. So basically the idea is all of the data is in one field, which makes it really, really simple, even for the simplest, inexpensive readers to read. Like everyone that's out there doesn't have to do multiple reads. You read everything out of the EPC and parse that. So all the data is immediately available. And it's trivial to go through and parse the data and put it available. Now, what you do with it is important, but to have every bit of it, the serial number, the lot, the expiry, means that you can do instantly against a memory, a table, so you don't have to do any lookups. Here's the part that I've written a lot of APIs in my time, and I know I'm trying to get my sub-second response time down to 1/10 of a second, 100th of a second. But if I have to read 80 something, remember those totes that we packed out? We packed out, the zoom in is starting to see.
There you are.
Wow, that's for emphasis. No, the idea is like when you have a tote packed with 100 items from different manufacturers, are you going to call 5, 6, 7, 8 different manufacturers APIs? You wouldn't be able to turn around the data in time to be able to make a decision whether or not it goes into a hospital lane or if it goes into inventory, or it goes into the pharmacy down to. So all of the data that's necessary and all the data that's required to compare against what's in the EPCIS data file, which is already available to you, is now available on the chip if you write it there. If you decide to make it so it's a lookup, now you don't know when you're going to get it. You don't know if you have internet connectivity. Even yesterday, Starlink went down for 2 hours. So we're talking even the most solid available internet across the entire world in 100-something countries is still going to go down periodically. You want to be able to have instant access at the edge. And the most edge that's out there, the furthest edge is the actual item itself. So that's why we believe it, and then fix it as soon as possible. Find out the error and fix it as soon as possible in the process. You're good. If there's an error, it's way better to find it earlier in the process than later. That's what this does.
And everything's right there to show you what it's about. I've been in a few hospital waiting rooms, and trying to keep internet connection is half the challenge of it. Just to keep yourself entertained. No less try to make decisions that are critical. So
Angry Birds, is that what you're doing? Angry Birds.
and yeah, that's but let's move to George. George, let's put some heavy lifting on the chip manufacturers. Are you and Impinj comfortable with being tasked to store critical patient information on these tags?
Yeah, but the endpoint IC is designed to carry digital information, and there's memory available for GS1 encoding scheme, and having the right amount of information in the endpoint IC or the label that's carrying the critical information about the item. So, for example, having that information on the tag and securely on the tag through locking it and password. If you need access to critical information about the product, what was the expiry? Or maybe I have a recall and I'm looking for a lot number. It's already on the item. You can filter, you can find those things instead of parsing through large data sets. So it gives at the point of use, I call it, where I'm engaging with this tagged item and I need to know something about it. Where was it? Where did it come from? Or perhaps there's some information that I need to find it quickly. So how do I do that? So that's where having that relevant critical information in the tag can have more benefits, points of use downstream than just accounting through the supply chain. So as an enterprise, you really need to be thinking about what are my use cases and points of use that I want to get out of using the technology. Why? Because it's on the tagged item, and that item is in a box, it's in a case, it's on a pallet, then it gets back down to a case, to a box, to an item, and you've got different stakeholders engaging with it. So having that critical information there when you need it. So I want to know, what is the item? Is it expired or not? I want to know the lot number because I want to make sure there's not been a recall or perhaps some issue that I'm worried about, or if I just want to do my inventory cycle counts. So the tags are the endpoint ICs are small, they're passive, they can carry the right amount of information, but not too much. So it's just fit for the application.
Yeah. Well, I always think of, when vaccines or drugs are administered in remote places, and how do you track it? How do you know what you have when you don't have an infrastructure around you, or Starlink goes down for 2 hours? So
exactly. And you're talking about medications that are saving people's lives, and so there's the patient experience and patient safety aspect of it. So what is your operation in terms of, like, how much is the enterprise or hospital paying to achieve a safety level, right? And reliability and confidence level. So they're going to hire RAIN RFID as a tool, as a solution to help them with that. And then you have your normal operations, right? I'm moving product from point A to point B. I have my suppliers. I'm managing inventory. I'm giving people access to that critical product. So you want a solution that in some ways is very transparent and visible to the day-to-day operation of the human, and then lower cognitive loading and make it as efficient as possible.
This is one of those, like, let the computers do what they're good at, and let the humans do what they're good at.
Exactly.
Yeah, humans are great at problem solving and dealing with creative things. We're not good at memorizing numbers and scanning things and pointing at the right. That's where the technology you put together. In fact, let's just mention this, George. We used in Impinj chips throughout this entire thing. The entire study was using Impinj chips and Impinj readers, oddly enough. I mean, so the reality is, it was the technology you brought to the table that made it so the human didn't have to do all the hard parts that we're horrible at, including packing totes, apparently. No, that was me. Anyway, go ahead, Dirk.
Yeah. Well, I'd be interested in Bahar's take on this from an educator environment at Michigan State University. What are your thoughts?
Yeah, exactly. Putting my education hat, I always try to use examples to make the scenario easier. So I travel a lot and I fly a lot. So last time I was sitting in the airport waiting to be boarded. So I was thinking about RFID and this pilot and the situation in the airport, and I said, oh wow, this can be a very good example. So imagine all of the passengers going on an airplane as our pharmaceutical products. So we're going to tag them, giving them a unique identification number, which is their name and last name. And we give them the origin, the date of birth. We gave them where they want to go, like the origin and the destination based on their flight. We give them also some expiration dates, which is in this case their ages. So all of them, they have the entire package of all this information. So now we want to start boarding. Just imagine the line that is now, everybody has this boarding pass with the traditional barcode. So everyone needs to scan all this information to get into the airplane. And the airplane can be our RFID enabled tunnel. So imagine a scenario that somebody within the line missed the boarding pass, or they have kids, the boarding pass was wet or damaged, whatever. So they're not able to scan that boarding pass. So the queue, the line, the traffic, the angry people, and everything will happen before all the passengers get into the airplane. But in an alternative solution, imagine that all of our RFID-enabled passengers, they get into the RFID tunnel, which is our airplane, without the need to scan their boarding passes, and all of their information, name, surname, age, destination, origin, all of this is automatically uploaded into the captain's folder, which in this case of the pilot was the eAgile CCL software or the ERP local system that manages the inventory. So then the captain, before taking off, can check automatically and make sure that all the passengers are on board. They can immediately capture if someone is missing, if we have overboard, or if somebody is getting this flight by error. So they can fix it right in the place before taking off. So then the flight goes on, and then imagine the destination airport, O'Hare, with a lot of flights coming from different origins, with different people, with different passengers, different information. So in this case, the Axia Observer platform is our control tower. So all of those flights, they need the captain, they need to share the information about the flight with the control tower in order to make sure that everybody is landing safe and there is no traffic and so on. But all of these flights, they're coming from different origins, they have different passengers, and they have different languages. But they all need to communicate with a common acceptable language with the control tower. So in the case of our pilot, the EPCIS, GS1-based EPCIS format is considered as a common language that all of the flights, they can send their information to the control tower using that language. So then the control tower needs to make sure that all this information are collected from different flights, and needs to make sure that even during the flight, if there is a turbulence coming, if there are some emergency landings or so on, the control tower or Axia Observer platform can immediately let the captain know that they need to change or they need to go back to the origin and so on. So all of this information are necessary in order for the flight and all flights to land safe in the right destination without any delay at that final airport. So in this case, also, like, again, RFID is the technology, the tunnel is the plane. Again, the ERP system or local inventory management system was the software, the eAgile CCL software that was connected to the RFID tunnel, and Axia Observer was like our control tower. Without having all of those correct information, we will not be able to land safe. So that shows how important is having correct data and correct the data right in a place before the flight is taking off. So I see that
Yeah.
as this example, which makes it easier for me then to understand what is EPCIS, why EPCIS is important, why all of this SG10, batch, lot, expiry is important, why Axia Observer is important. So in my mind, like those create the puzzle and then make everything work together as a system.
Yeah, that's a great
Excellent.
analogy to help
I like that
understand
analogy.
it, yeah. In some way, they would still find a way to lose my bags. I don't know how.
Oh.
Well, let's hit
The
our
control tower.
our next question here, and for our next kind of roundtable discussion. What I see, RFID seems to be gaining traction across a lot of markets, and it's going beyond retail, where everyday items like light switch plates are now tagged. And this seems particularly true in healthcare. Let's talk about what's driving this and how does it support global healthcare improvements. Let's start with George this time.
Yeah,
I'll let
sure.
you kick this one off.
Yeah, I think RFID, RAIN RFID has an entry point into a market, into a supply chain. It's been well documented around apparel that in-store inventory accuracy was the big industry problem, and the technology was able to deliver a strong ROI. And through that strong ROI, there was adoption that accelerated through the marketplace over a very short period of time, and then it's certainly been adopting broadly from there. Then you have other trends like e-commerce and online platforms, which further acted as an accelerant to the apparel movement of the adoption of RFID, and that's well documented as well. So I think you look at, there's a business problem or a business challenge, and then there's an entry point for the technology, which is around cost and performance and the value it's going to deliver. So I think today, there's certainly a lot of value in the readability. There's a lot of performance in the readers themselves, whether it's a fixed reader or reader module. So as you'd expect, your iPhones today are much better than they were when they first came out from your first iPhone. So technology will continue to advance, but I think it really, the business problems and the business drivers is what really will create that pull for RAIN RFID. So in food market, for example, you could think of what was the industry dealing with many years ago and potentially now? Labor shortage. Labor costs are going up. So what happens is an enterprise starts looking for, I now have a business problem, or I have business value that I want to create to differentiate myself from my competition, or I want to delight my customers in a new way. So that's where they start looking at, hey, let me look at this RAIN RFID. I've seen it over here in apparel. I've seen it now in food. I want to study and understand more about it. And as they learn, it's this, where's the entry point for you? Is it your supply chain? Is it internal? Is it your external stakeholders? So so I think there's just now a common, comfortable understanding of RAIN RFID. The technology works today. There are proven deployments. And I think with this study showing it in healthcare, where you have a high density environment with a lot of data stored on the tag in real time and making it transparent to the business operation is very exciting. So whether it's food or logistics or apparel as we know it, or general merchandise, I have better accuracy and better inventory. So an item might be low cost, but it's high velocity through the supply chain. Well, if it's a high velocity, that means people might be buying it up. Years ago, I asked a customer who was deploying RAIN RFID, and I asked, well, if I'm a customer and I walk into your store, how would I know, without knowing the technology is there, that it's actually working? And they paused and said, our shelves would be stocked with the right things you'd want. And so high velocity items that you'd think, oh, why would you tag those? Well, it's a low cost, but it's a high velocity. There's value there. You might have the opposite effect, where you have a slower moving inventory, higher cost. So you don't want it to sit as long, right? So you want to understand, keep the right amount of inventory. So I always go back to the business case, the value drivers for the company. And I think within healthcare in particular, there's a lot of now strong use cases with RAIN RFID having smaller tags, working in challenging environments, software capability, and this thirst for creating digital data from the tagged item and ingesting it into some platform or platforms to then synthesize that into actionable data and potentially leveraging, machine learning algorithms. So there's a natural drive for data. And if you can
Yeah,
put it on the tag, the critical data on the item, as we talked about today, there's immense value that you can achieve from it.
most definitely.
Absolutely.
And yeah, there's not that light switches aren't important, but there's other critical things out there that we
Exactly.
need to know that are there. And even from a customer service standpoint, when I go into a store or I've ordered something online and I'm going to pick it up at the door, if it told me I
Right.
bought it and it's going to be there, I appreciate it when it's there, and
So
and I can pick it up and I don't have to get substituted.
Yeah.
let's talk light switches now, right? So here's a light switch I bought at Walmart. It has RFID tag. It was 47 cents. I bought this light switch. It has a serialized RFID tag that tracks it throughout the entire supply chain. So this doesn't get into somebody's veins, right? This is just a piece of plastic with a couple of screws, and it's tagged. The idea is we have this precedent of RFID being available on items throughout Walmart. The question is, where are our priorities, right? Why are we doing this as opposed to medicine, right? Individual. So this is down to unit of use. And in this study right now is unit of sale. So that's what this study was. But we're talking about this whole thing. How do you add value? And this is one way that starts to extend beyond, oddly enough, retail into pharmacy. So anyway, that was my bet on that. There's a light switch.
Yeah, yeah. If the light switch isn't important enough to tag, or the cover, medications where, I need, track them accurately. I need to reduce errors. I need to support recalls, fight diversions, that's, higher use value for, than the wall plate there. So, but, Bahar, what are your thoughts on this? This is,
Yeah,
driving
I think
growth in healthcare.
Yeah, I think the technology is moving so fast that I will not be surprised in a very near future when also the Qualcomm initiative is done and we have RFID reader capabilities within like the smartphones in hands of the consumer or patient in this case. I think it's not so far to think about having individual items being RFID tags, and then the individual item before being used being scanned by the patient to get all the information that they needed from the manufacturer to their hands. So I think that's the next step, and that's the revolution in healthcare, which gives all the patients also the capability to make sure that the medications that they're using are safe, are authentic, they're not expired, and they're coming from the origin that they expected, and so on. And so to me, that's not so far.
Yeah, yeah. I think anything we can do to make it easier for our caregivers, doctors, nurses, and we're being tasked with being in charge of our health more every day to take control of what they put into you and have an active part into it. And,
So like the question is, what tools have we given them? I mean, we're just starting this. We haven't given them the tools to make this easy, right?
Yeah.
Certainly the cabinet systems and stuff are good, but not to be able to validate entire boxes of stuff or check, until RFID came along, it really wasn't possible to do 100 items at once. So this is let's figure out those tools.
yeah, yeah. Well, we got a couple of minutes left here that we can do some Q&A. We got a couple of questions in from the audience. And I think, Aaron, maybe this first one, because you were right there on the floor, question is from, how did you solve the cross-read issues when you passed the tagged items through the tunnel or the RFID portals?
Yeah, that's a great question. And it is a big deal, especially when you're trying to, more so important when you're shipping out, like when that zoom is
extreme close-up.
Very important. So no, when we have a tote leaving, like when you want to capture the serial numbers and each item, you don't want to get one stray read. When you're receiving, you could ignore something that you saw that was incorrect, right? But when you are shipping, you have to have 100% isolation to validate because you're grabbing each serial number. So what we did in this case is the tunnel has on the end, it has I guess a curtain that's blocking most of it. We did turn down, I mentioned that we didn't fine tune very much but we did turn down the power a little bit because there were a couple of times if like, as you can imagine, the 3 or 4 or 5 of us are standing around. We want to be as most efficient as possible. So we're ready to right up against it with another tote. So periodically it would read one of those if we were right up next. So we turned down the power a little bit. It didn't need that much power anyway. It was reading some things like that. So once we got to that level, we dropped it through. Basically, it did a great job of keeping it all absolutely clear. If it missed anything, or if it read any additional item, or if it would turn it around and we'd run it through twice. That happened infrequently, but it did happen. And once we reduced the power a little bit, it didn't happen very often at all.
And just adding to that, you can also see on the screen behind Aaron, the tunnel that we used. So this specific tunnel that we used has also some protecting shield.
Yeah, this is it right here, you can see.
Yeah, that also eliminated a lot of like extra reading because the environment was full of RFID tags.
And it stopped for about 2 seconds, right? So it said it allowed the curtain to stop swaying, close there, and then it would read everything, just bombard it with electricity, and then it would send it out. So it was, and that's also configurable, how long you wanted to sit there. That's what we did.
Yeah. Another question we got is what type of products were being packaged? And more specifically, did this include products that contain Axia solutions or other high dielectric, constant or metallic items? You touched on it a little bit, but let's circle back to that.
The products that we tested in this pilot were 4 different pharmaceutical products, or were liquid products. In the glass or plastic packages, the glass ones, they had aluminum on the cap. They were vials. So all the potential barriers for RFID were included in this pilot. So the pharmaceutical products,
yeah. There's a box of cotton balls. We got that one. It was actually what is going through there, and the vials and the syringes and filled with water in glass and all that. So that's good to know.
It was interesting. So I went to the HDA conference recently, the Healthcare Distribution Alliance, and the FDA was there and stuff. And so their questions on this was, okay, what studies have you done? Are there additional studies coming? Because they had never seen this function either. They've been working on DSCSA for decades, right? But they've never seen it actually functioning. So they were happy to see us coming up with a way of doing this. And it's important in this situation, especially a study like this, that we do actually have real pharmaceutical, real medicines with a real use case in a real facility. And that's what we ended up doing, including hard to tag stuff. It was unit of sale. So we were right up against the liquids, in this case, units of sale. We do address here unit of use at CCL eAgile, but that's what's a part of this particular study.
Yeah, and I think as the studies go on, we'll show that you can get down to the unit of use there and still conquer some of those typically difficult to tag items that people formerly thought was going to be a big hindrance. So I've got, let's see, one more question here, and I'll kind of paraphrase it a little bit, but first wanted to congratulate you on the successful pilot. This is from Vlad Serbin. He says, if tag costs weren't a factor, what's the top barrier to getting to 100% supply chain observability across healthcare and other industries? And how is that blocker being tackled? So kind of what's the barriers and how do we get around those to bring this all out there?
My take is that it has to be basically the manufacturer that does it. I mean, so if they're tagged at Cencora, half or more of the value is gone. It has to be done way at the beginning. The positive to that also is if they do implement it and they put tunnels on when something is leaving, they are getting the benefit of the validation, right? So this is something that Andrew Meyer calls the what was it? The cat, the dead cat in the box. I can't even remember.
The Schrodinger's.
Schrodinger's aggregation, right? If you don't open the box, it's probably fine. You don't know if it's dead cat or a live cat, right? So if you do actually have RFID, now you know Schrodinger's aggregation is no longer a thing. You actually know as it's shipping out, you validated everything that was done earlier, and now you know everything's properly done. So I think that's one of my take. I don't know what else George and Bahar feel.
I think, I mean, certainly the trend that I've witnessed around the adoption of technologies, and an enterprise or company who is vertically integrated to a large portion of the supply chain, or if they have partners that they are really close with in terms of, how they operate their business. So typically the entry point for RFID might be, I'm vertically integrated. I've got a product line that I'm interested in tagging for this business value. Start there. And if they have willing participants in the supply chain to collaborate on from end to end, I think that's where you really need a lot of put a lot of energy into your partners and your supply chain to bring them on board. So part of this Axia pilot study is to say, look, real value, real benefits. And you can take that then to your supply chain partners and bring them together in a room, talk through the study, talk about what your objectives and goals are, put on the table what the limitations are of data transfer, information transfer, and how that would work. And start small, but move fast. Because I think once you see the value and benefit in RAIN RFID, you'll want to make that a major initiative for your company. Just some words of wisdom from experience in the industry.
Well, it's kind of like, it's important to go to the store and they have my shoe size, but it's important to go to the hospital and they've got what I need when I get there, or can locate it within their resources. So
if the problem is large enough and the risks are high and the company wants to really make a difference, your partners and ecosystem will come along because there's real value in it. So that's just need a lot of energy behind it and flow. So yeah.
Got some other good questions, but we're getting down to our last few minutes here. I got a couple of key takeaways. I'll give everybody an option to jump in after me. You can think about it now. But to me, one, the Axia pilot proved RAIN RFID achieves 100% traceability with essential data on tags, catches errors in real time, not only meets but enhances DSCSA, and above all, ensures patient safety. And not only that, it's efficient, scalable, seemed to be easy enough for a salesperson, as we always used to say, ready to transform healthcare and beyond. So anybody got any quick bullet points they want to throw out here in our last 1 to 2 minutes?
I'll add on that one bit saying, if they would have known that this technology existed back when they wrote DSCSA in 2013, this is the spirit of the law. This is what was meant by it, is keeping out counterfeits by making it so that aggregation is easy and almost trivial to validate. And that's done with RFID.
True.
Great.
Well, at this time, let me thank everybody again for being our guest today. Bahar from Axia, George from Impinj, and Aaron from CCL eAgile, as well as all of you who have listened in and gave us some good questions to hit at the end. There's a few good in here that maybe some of us will try to reach out and connect with to address. But this time, I think I'll send it back to Elizabeth at RAIN for any last minute housekeeping.
Thanks, Dirk. And thank you all to our panelists today for a great discussion. I just wanted to remind everyone that part 2 will be on the 21st at 1 p.m. Eastern. So don't miss out for another chance to continue this great conversation. The recording for today's session will be made available at the end following the close of this presentation. But I just wanted to thank everyone again and have a great...
I just want to mention one thing. The 2 people I mentioned today, Sean Murphy and his fantastic quotes, and Andrew Meyer from GS1, so are going to be on the next one. So this is a great group, and I actually hearing specifically from Cencora and what they saw with the study, because it was done in their warehouse, right? It was done next to the pallets of other drugs, of things that are there, and how they were passed. So the next one is going to be really great just to understand their perspective. So if you get a chance, come on Thursday.
Very insightful for the distributors out there. Yeah.
Great. Thank you, Aaron. Great pitch. Well, thank you all again and have a great rest of your day.
All right. Thank you
Thank
too,
you.
Elizabeth.
everyone. Thank
Take
you.
care.